Welcome to the MedPeds program with the University of Rochester. I'm Brett Robbins, Program Director, and we are very fortunate to have for over 50 years stood on the shoulders of giants in our two categorical programs. And I wanted you to hear from the directors of those programs today what they're most proud of. And we'll start with Dr. Karen Gellin of Pediatrics and then go to Dr. Amy Blatt of Internal Medicine. So Karen, take it over.
Hello, everyone. I'm excited that I get to virtually speak with you today. I think probably the most important thing I have to say is that you are not guests in our program. You are peds when you are with us. And the things I'm going to tell you about are opportunities that you have in your time as a peds resident.
I'm Amy Blatt. I have the privilege of having been a graduate of our MedPeds program. So when I'm speaking to you about the integration of the MedPeds residents into the internal medicine program, and I can also speak to it being true in pediatrics as well, I can tell you that it's really the truth.
I think the things I'm most proud of in our program are really three things. One, first and foremost, our residents. And there's lots of reasons for that. We talk a lot about teamwork in medicine, and I think that is how we treat each other. I think that is also how we work together across our different professions. And one of the things you'll get to experience in your PEDS 4 time is actually working in interprofessional teams where you have seniors, APPs, and interns working on the same team together, not parallel playing, but actually working in an integrated fashion. And that's a really important part for how healthcare works. And you will get that experience during your training. I think the other thing is that pediatrics in Rochester is a really unique community where people in the primary care setting, even in private practice, are part of our pediatric faculty community. It's a really unique part actually about pediatrics in Rochester, and you have to come here to really experience what that means. But your community and your team is much broader than just the people who work in the hospital or in the clinics. The other part of that teamwork actually though is, right, what do we do to support each other in learning? And so when you come here, I'll tell you on day one, right, I expect you to own your patients and own the program. And what that means is to really accept the responsibility of being a patient's doctor. And that is, and from a faculty perspective, we talk about how do faculty support you in that autonomy piece to really own that patient care. And then we're always looking to make our program better. This is an institution that has Meliora as its motto, if you will, which literally translates to ever better. And when we talk about how do we make things better for patients, how do we make things better in our program, you are an important part of that. It's not just the categorical residents who have a say in that. MedPeds residents are integrated into every part of that process in our program. The second thing I'm really proud of is the balance of the education you'll get in pediatrics. You will spend time both here at Golisano Children's, which is a tertiary quaternary center, as well as Rochester General, which is a community hospital about 15 minutes away from here. And so you will get to experience not only the breadth of conditions and patient diversity in pediatrics, but also how do you handle situations with different both personnel and physical resources available to you. And so you will get that experience no matter what you want to do in pediatrics. When you graduate from your MedPeds program, you will have experience in doing that. It also is something that reflects the individualization that you can do as part of your training. So we have several tracks, and you'll hear more from Dr. Blatt as well about that, but we have several tracks. And again, because you are peds, you have the opportunity to participate in any of those tracks along your training time. The third thing that I'm most proud of is actually the work we've been doing to make our learning environment better all the time. We have a lot of things that we do around wellness, and you'll likely hear from Dr. Robbins around how you get to go to triple the parties, basically. You have 3 programs of fun. But it's also how do we think about wellness in the space where you're actually working, not just fun events and food and all that stuff. We have that stuff too, but how do we think about making the place where you work better? And I'm really proud that we actually launched our concerning interaction reporting tool this past year, which is an anonymous reporting tool that allows people to say, hey, if something didn't go well, even though we're doing lots of stuff to make that happen, we have a way to make it known to the program that something needs to be addressed, and then therefore we can address it. So we're really doing tons of work all the time around ensuring that our learning environment is really optimal. I'm going to pass it over to Amy.
Similar to Dr. Gellin, there are three portions of our program that I'd really like to highlight for you. I think first is the diversity of the training opportunities that we offer in the Department of Medicine. As MedPeds residents, you, just like all of our internal medicine residents, will be fully integrated into your teams, both in the inpatient, ambulatory, and ICU settings. We have three potential core training hospitals that you have the opportunity to rotate at. Strong Memorial Hospital is our main university-based hospital. Highland Hospital is one of our community affiliates that's really well known specifically for geriatrics and palliative care. And FF Thompson is a newer addition to our hospital affiliations that is in a slightly more rural community in the beautiful Finger Lakes. And all of our residents have the opportunity to participate in inpatient care as well as ambulatory electives at all of those sites to really get a different feel for some of the differences in the resources that are available in different hospitals as well as the different communities that they serve. Another piece of the diversity of opportunities really does lie in the wide range of electives that we have to offer in internal medicine. Between multiple ambulatory electives, both specialty as well as subspecialty electives. So not just a general cardiology elective, but also if you have an interest in electrophysiology or advanced heart failure, those opportunities are available as well. There are also numerous less specific subspecialty electives, including point of care ultrasound and procedural electives that all of our MedPeds and internal medicine residents can participate in. And similar to Dr. Gellin mentioning specialized training tracks, we have a number of them that MedPeds residents can participate in. Some of the highlights and the most popular are our clinician educator track, our procedure track, our point of care ultrasound track, and more recently our QI track. I think QI is something to highlight, and that's something that's really important for all of our programs, but that's really part of the process that our residents make things better, not only for our program, but also very specifically for the patient populations we serve. All of our residents get involved on the pediatric or medicine side in different interprofessional QI projects to really find opportunities to improve the care that we are giving. The next point I'd like to make and highlight is how we really try to provide supported autonomy in the care that you provide. And this is something that everyone is going to grow at a different pace in their educational process and training, but we really like to give that opportunity for people to grow. So you're going to have the support you need, but you're also going to have that challenge so that you can continue to grow and become independent physicians. And those opportunities exist in all of the settings that you'll participate in care. And finally, I would like to highlight team-based care and education, because I think that's really a very important aspect of the internal medicine program. You are going to care for patients as part of teams in all settings, working with nurses and physical therapists and occupational therapists and social workers to provide the best care as you're taking care of patients in the hospital, in the ICUs, and as you're transitioning them back to their primary care doctors. That is a fundamental part of our inpatient rotations, is to participate in interdisciplinary rounds. And we also have monthly education sessions with our nurses where there's that opportunity to exchange ideas and work more collaboratively together. I also want to highlight part of team-based education are the educational conferences. And one of the exciting things that we've changed in the internal medicine department this year is to have level-specific education for our interns as well as our senior residents that is delivered during some protected time during the noon conference weekdays. That's something that our MedPeds residents participate in when they're on internal medicine rotations. And so far it seems to be incredibly successful, but it's a really good way to get to know each other interact and learn in an active and supported environment where you have the time and you are protected from your clinical work to do so. So with that, I think I will hand things back to Dr. Robbins.
Great. Thank you both so much. I'm sure that the applicants got a sense of the commonalities amongst us and that we actually share ideas and get along, and it's pretty darn fun, actually. So thank you both very much, as always, and I'm sure I'll be talking to you soon.